how are you? I'm Sandra. I'm one of the Coolsculpt technicians here at Allure Medical, and today you're actually going to witness a live demonstration of one of our treatments. My lovely assistant here is Amy, and we are going to be doing the lower abdomen on her. We're going to walk you through the marking, the preparation, and then eventually the hooking up of the heads. I will show you the heads and what we normally do to prepare for it and after, and then you'll be able to see it from start and then at the end of how we unhook, massage, and what to expect. So let's go for the ride. Hi Amy, how are you?
Good, how are you?
Good. So like we said, we're going to be doing your lower abdomen. So what I normally do first is we're actually going to mark the patient up. So we take a look at the area of concern, and they have to have the subcutaneous fat, They have to have a subcutaneous fat, which is that stubborn under the skin fat that goes nowhere even after exercise and dieting. So those are resistant to diet and exercise. So what Coolsculpting is FDA cleared to permanently freeze and get rid of fat cells. So it's not weight loss, it's inches loss, it's debulking, contouring. For women, giving you back that hourglass figure, and for men, giving you that V. So making you more comfortable in your clothing and in your own skin. So that's what we all want, right? So that's what Coolsculpting does. So let's take a look here. So here, as we see, Amy is very fit. It's just some parts are resistant to diet and exercise. So we just kind of pinch and grab. We say if you can squeeze it, we can freeze it. So take a look here. She has the perfect amount of subcutaneous fat on both sides. What we do is we mark the peak of the fat, which is where it kind of bunches up together, and we make a little X. Other side, we make a nice other little X. So what I'm going to do is actually to give her back that hourglass figure, we have to mark her up in kind of a V look to contour her through the waistline. So I'm going to take my template and I'll place it over that X. I'm going to make little markings here to kind of tell me where I'm going to be placing the head. Giving her temporary tattoos for today. And then we take our plastic template and we kind of put it over where the X was, and we're going to circle around it to give us an idea of how much the head is going to cover. And these new heads are amazing. They actually cover twice as much surface area as the old ones used to in less time. We have no downtime with Coolsculpting. Honestly, it is the best non-surgical alternative to fat loss before you consider liposuction or like tummy tucks. And you can get this done on your lunchtime. Go back to your normal life and nobody ever has to know you had anything done. So we've got Amy marked up. Now normally we would do photos at your first session, measurements, consents, all those kind of things. But for the sake of time, we're just going to get her marked up and get her ready to go. So what we're going to have her do here is we're actually going to have her sit in an upright position because we want to be able to grab the fat as it presents itself, because gravity does take its toll, so we don't want anyone lying down because the fat can distribute itself differently. So normally what I like to do is get my patients nice and comfy. I'm covered up with our Coolsculpting blankets here. And I'm going to go ahead and raise her up a little bit so she can kind of be at the level of the machine. Now, if Amy was having multiple areas done at the same time, we could use both machines on her and kind of hook her up in different areas at the same time, like for instance a love handle, which we call flanks, or a lower abdomen at the same time. But because we're doing just the lower abdomen today, we cannot hook up two heads at the same time because they would be competing and pulling the skin in opposite directions, and you would not get a good treatment. So just for today, we'll be using one machine. This is our machine over here. We're actually going to be putting in the specifications, so she is a female, and we are going to be doing her lower abdomen. And then it asks if we have a gel pad. So normally what we do first is we're going to cleanse the area with a prep pad, an alcohol prep pad. That's all it is. It's just cleaning the area, preparing it for treatment. Alcohol prep pad. Just going to be cleaning this side since we're starting on this side first. And there you go. We'll let that air out a little bit. This is the gel pad that we're talking about. So it kind of looks nice and sticky on the inside just because it's made with glucose, so it's meant to harden and protect your skin from frostbite. What Coolsculpting is, it uses cryolipolysis, so it's a freezing technology, which is going to freeze obviously those fat cells. And so to protect your skin from frostbite, we're going to put this gel pad over it. So nice and gooey and sticky. And we can actually kind of play with it a little bit because in packaging sometimes that gel goes to one side, so we have to make sure it's all covered nicely. So what's nice is that they don't tear, they don't rip. Very durable, very sturdy, very good with this kind of action here. So we're just kind of playing around with it. All right, so what I'm going to do is I'm actually going to apply it over where I made that first initial circle over here. Excuse me. It might be a little bit cold when I apply it. But we make sure that it covers the whole area of concern and that there are no folds or bubbles anywhere, so that the applicator head can sit on it without any complications. Alright, so now that we have the whole area covered, actually I'm just going to put this down a little bit. It was nice and sticky, huh? Okay, so we got the gel pad going. Now it's confirming that I have all areas of my applicator head put in. So we have a gel trap in here that we apply to catch all that gooiness from the gel pad. We have the actual template itself on the outside, and we have what we call the gasket, which is going to be inside underneath the template, and this is what keeps the suction going. So if you don't have that, you lose suction. So we're just going to click that in place. And this is the Cool Core. This template is specifically for abdomen or areas of smaller pockets of fat. We also have Cool Curve, which would be more curved, more for love handles, bra fat, other areas that kind of have a little bit more of a mound shape to them, or maybe to sit next to bone. And then we just, confirm this, and then we're just going to turn this on, and as you can hear, the suction is preparing. So all we need to do is just apply it to Amy's area of concern, and we apply it right over where that circle was, and it should fit perfectly. So I like to do it in an upward scooping motion, so it kind of grabs everything, and it just suctions enough to sit on the area, so there's no pulling and grabbing anymore, there's no pain involved, nothing like that. So I'm going to have Amy hold this for me just 1 second. I like to apply a boppy. There are like straps and everything, but just for the sake of demonstration today, boppy does the trick. We're actually going to hold it in place like that. And I'm going to use this machine to kind of keep everything in place. And I'm going to lock that. And I can actually put a little towel to keep that steady so it doesn't go anywhere. Coolsculpt is all about improvisation. So, and then you just cover Amy up. Out of sight, out of mind, and then we're going to turn on the cold. Now normally what a patient would feel when we initially turn on the cold is a little bit of that burning sensation. So you have to think of it like you're going outside to play in the snow, you stick your hand in the snow, it's going to feel a little bit of freezing sensation, like that cold burning sensation. But after a couple minutes, she should start going numb and she won't feel it anymore. It's a relaxing 35 minutes with the small head, 45 minutes with our large head, and that's as much as they are. So it's pretty easy peasy. They're not as long as they used to be. So after 35 minutes, I'm going to come back in. We're going to unhook the area. It's going to be a little bit red because of that freezing sensation. And then I'm going to remove the gel pad and do a 2-minute manual massage. What that manual massage does is it helps break down those frozen fat cells to help you expel them through your lymphatic system. So the way you're going to expel those fat cells is you're going to urinate it out, sweat it out, or defecate it out. So the more water you drink, the healthier lifestyle you lead, the quicker you're going to see those results.
We have a question, how much for Coolsculpting?
So I get that question a lot. Unfortunately, we cannot say how much it is because it's not a one-size-fits-all. It starts off at $2,300, and that is for one area. So for instance, what Amy is doing right now, it would be done twice. We always do our packages in 2 treatments because the first one kind of loosens up everything, gets everything started. Second one, which is a month later, so they're a month apart, comes in and kind of destroys everything that's left. So we do 2 treatments, and that would be both $2,300, and then it goes up as you add more areas. Now, I will say, when you come to Allure and you get your free consultation, the more areas you add at your first consultation, the cheaper the package will be. So as opposed to coming later on and saying, okay, you know what, I want to do another area, it might be a little bit more pricey at that time. But that's about it. How do you feel, Amy?
I feel good.
Good. Did you feel that burning sensation at all?
I started to feel
Okay, and then eventually, so we're only about 2 minutes in, so give it another 2 minutes or so, usually about 4 to 5 minutes, and the patient stops feeling it, because then they go numb. And then, as you can see, this big spa-like room, we have a TV, we offer, refreshments like water, tea, coffee, and then healthy snacks, and reading material, so you'll never feel bored, and the 35 minutes will actually fly by before you know it. So we're going to leave Amy to her treatment right now. If there's any other questions, please feel free to ask. Aside from that, I'll see you in 35 minutes when we unhook. All right.